This interview covers topics involving suicide and suicidal ideologies. Viewer discretion is advised. After years of advocacy, Canada has announced a new three-digit suicide prevention hotline. Outgoing Mental Health Minister Carolyn Bennett announced this week that the federal government is putting $156 million over 3 years toward the hotline. Starting on November 30th, people in crisis will be able to dial 988 anywhere in Canada. They will be connected with trained responders 24 hours a day by phone or text message. This free service will be offered in both English and French. The Centre for Addiction and Mental Health will receive the money to launch and operate the hotline. Conservative MP Todd Doherty for Cariboo-Prince put forward the motion to establish a national suicide prevention hotline in December 2020, and the House of Commons passed it unanimously. Well, joining us now to discuss the prevention hotline is Todd Doherty himself. Mr. Doherty, thanks again for your time today.
Thanks for the invitation to be here, Nima.
Now, it's interesting that when you first put forward this motion back in 2020, the motion was passed unanimously. But why did it take so long for this 988 hotline to come to fruition, Mr. Doherty?
Well, that's a great question. In December 11th of 2020, Parliament gave the will of the House to government to implement 988, to immediately bring 988 to Canada, and it will be over 1,000 days before or when a 988 launches in November 30th. So it's taken a long time, and it's a good question for the government as to why it took so long.
Definitely a very long time, sir. Now, it seems that suicide is a huge issue in Canada. Minister Bennett highlighted that 12 people
Mhm.
die from suicide in our country. So, what do we know so far about the impact that intervention or simply having someone to talk to can have on someone thinking suicidal thoughts?
Nima, it's not just the 12 people that die by suicide every year. We know a further 200, at least 200, try suicide or attempt suicide each and every day. And those are just the numbers that we know because of the stigma surrounding suicide. Many suicides and attempts go unreported. Studies show that after speaking or having intervention with a crisis care counselor, those that are considering suicide are less likely to consider, and if there's options available for care or for treatment, they are more likely to seek that out.
Some very concerning numbers you've highlighted, sir. Now, we know back in 2022, the U.S. launched its own 988
Mhm.
suicide hotline. So, what do we know so far about the success of their program south of the border?
Well, it's been fairly successful to date. Over 4 million callers or Americans reached out for help, and that was a 40% increase in call and text and chat volume. We know that their wait times decreased from almost 3 minutes to a minute. And we know that when minutes and seconds count, accessing a simple three-digit, easy to remember three-digit number can make the difference between life and death.
Some good news there, sir. Now, meanwhile, the Canadian Mental Health Association has warned that the number of calls through this hotline could lead to an influx of patients that require
Mhm.
community-based mental health services, which they point out as being underfunded. So, where do you stand when it comes to these concerns in particular?
Well, I absolutely echo the concerns of our mental health associations, both the national level as well as our grassroots level. Nima, when healthcare dollars are transferred or mental health dollars are transferred to the provinces, these grassroots organizations receive literally pennies on the dollar. Many times, these crisis and care lines are hosted by trained but volunteers. And when we're launching 988, we want to make sure that these services are alive and that a caller doesn't get a busy signal or be put on hold. So we want to make sure that these services continue into the future for perpetuity, no different than 911 or 911. So the money that was announced recently is old money. It was announced in the budget 2023, as well as the $20 million that was announced for the grassroots organizations was old money that was announced in 2020. So we need to make sure that this government or the next government makes sure that puts mental health, makes mental health a priority.
Definitely, sir. A quick 30 seconds left here, but what would you say are some natural next steps that need to be implemented to provide support for Canadians amid what is being called a mental health crisis?
Well, we want to make sure that we're breaking down the stigma. The more that we talk about this, like our interview today, the more we're normalizing that mental health conversation. And 988 will do that. It'll help, it will save lives, and we wanna make sure, as I mentioned, that regardless of where Canadians are, rural, remote communities, First Nations communities, that 988 is available 24 hours a day, 7 days a week, 365 days out of the year. When somebody is in need of service, that they can pick up the line, they can dial 988, and they'll get service and a care provider.